But they'll be on YouTube for you to take a look at as a refresher. If there's something that you feel like you forgot or just want to go over again, they're there for your viewing. Um, Also, if you have a friend that missed it, feel free to shoot them over the link to our YouTube channel so that they can view it as well. Today, we have Ryan McMillan with Bankers Fidelity joining us, and he's going to run the majority of this webinar. And we also have Adam Stockett, and he is our partner with Bankers Fidelity so that we can all push to grow our business together. So we really appreciate both of them attending today. And Ryan, I'm going to go ahead and throw it over to you, and you can tell them why they should be selling Bankers Fidelity.
Thank you, Courtney. I appreciate it. Good afternoon, everybody. Appreciate you taking the time today to hear what we have to say. Again, I'm Ryan McMillan with, sorry, my computer's going a little crazy here all of a sudden. Can you guys see my screen okay? So make sure.
Okay.
Okay.
Yes.
Again, I'm Ryan McMillan, the VP of Sales for Bankers Fidelity for the individual and senior markets. So today we're just going to go through basically a couple of our products that we have available to you all. And as you guys have questions or whatever else, please feel free to just ask or chime in. So, okay, so here's the agenda. So the agenda is going to this is what we're going to talk about. So we're going to talk about who Bankers Fidelity is. We're going to talk about our product portfolio just briefly. And then we're going to talk about our Vantage Flex Plus, which is our hospital indemnity product, and our Vantage Care, which is our cancer product. So we will then, I'll go in, I'll show you what our e-app looks like and things like that. Talk about some sales incentives we have, and everybody was like sales incentives. So talk about those as well. So if you're not familiar with who we are, Bankers Fidelity is a company that's based out of Atlanta, Georgia. They have been around since 1955, so been around for a long time. They primarily started off as a life insurance carrier in the 50s, and then the 90s they started getting into some med sup. And then here, whenever they brought me on board, they wanted to diversify their book a little bit more. So I built the cancer product. I did build the hospital indemnity product. We just launched a new Medicare supplement charter and all kinds of other things. So new life product as well. So, we're trying to become pretty robust in the other products world. We are A- rated by AM Best. I just got reaffirmed a couple months ago. And then we do business in some way, shape, or form in 46 states plus DC. So this is our product portfolio. So we do have a Medicare supplement insurance. We did just launch a new charter called Atlantic Capital. It's going to be in, 12 states now. So if you're interested in that, we could talk about that at another time. We also have short-term care insurance. We have a new final expense product we launched 2 months ago. And then the two products we are going to be talking about today are our lump sum cancer, heart and stroke, and our hospital indemnity. So Vantage Flex Plus. So this is our hospital indemnity product. It's like I said, I helped actually build this product. When I'm talking about this product, like I said, feel free to ask any questions or anything like that. But when I'm talking about this product, think of it as 3 different buckets of benefits. Okay. As I get into it, like I said, I'll explain what each one of those are. So the issue ages with this product are age 18 to 85. So I don't know if anybody on the phone actually does any ACA business or not, but most hospital indemnities out there go from age 45 to 85. And there's only a couple of us that actually go down to age 18. So if you are doing any ACA business and not just the Medicare supplement world or Medicare world, this is also a good product for those folks as well. So it is issue age, it is unisex and unit tobacco rates. You can do individual and spouse, individual and children and family. And then our guaranteed issue period is only 64.5 to 65.5. I know some of the other carriers out there have a little bit more extended of a guaranteed issue window. Actually, right when we were launching this product is when everybody kind of upped their ages on that. So instead of refiling the product or having to refile the product everywhere, we just kept it at the same mark. It could change in the future, but right now that's where it's at. It's guaranteed issue for that 64.5 to 65.5. Again, nice thing about these products, there's no networks, no deductibles. We do pay the client directly. We don't pay the doctors. So if they have if they have something that occurs, they submit the bill with the claim form to us, and we'll turn around and cut a check directly to the insured. So it just makes it easy. Now, remember how I said, think of this as 3 different buckets of benefits. So this is the first bucket. Okay. So the first bucket of benefits is going to be your base benefit options. And in most states, I have to say in most states, these are all benefits that will be included on every policy that you will sell. Okay. No matter what. You can't carve them out. You can't, say, I don't want that or anything else. These are going to be included on every policy that you write in most states. Some states have a slight variation thereof just due to state regulations or whatever. But in most states, these are all included on every policy. Okay. So you have to pick a hospital admission. You pick between $100 and $5,000, and that's paid out per admission. Okay. You can have up to 5 admissions per policy year. And then there is a 30-day separation window. What does that mean? Separation window. The separation window means that if you get admitted into the hospital, once you're discharged, if you have to go back in day 31, our plan will pay again. Okay. Now, why is that important? It's important because from what I've seen, everybody else in the marketplace is a 60-day separation window. Ours is only a 30-day separation window. So it does help your clients, obviously, if they do want a shorter separation window in order to get paid out again. Okay. Daily hospital confinement, you pick between $100 and $750. That's pretty industry standard. The benefit period options, which are the days that you get paid out for your daily hospital confinement. With ours, you could pick 3 through 10, 15, 21, or 31. Now, that is standard. Okay. Everybody else that I've seen pretty much has those same options for days. The difference with our benefit period options compared to others is that ours is a bucket of days for the year. Okay. It's not specifically limited to the specific separation period that you're involved in. What does that mean? So say you go into the hospital, you get admitted. Okay. With other carriers, say you have a 5-day separation or a 5-day benefit period for $300 a day. Okay. So during your hospital admission, you stay there for 5 days. Okay. And you use that benefit. Say you had to stay there 7 days. Well, it's only going to pay out the 5 because that's what you have. And then once you get discharged, you have 60 days. And then if you go back in, it re-triggers another 5 days. Okay. With ours, it's just a bucket of days for the year. So if you pick 5 days, that's how many days you have for the year. If you pick 10 days, you have 10 days for the year. It doesn't re-trigger after a separation period re-triggers, if that makes sense. The nice thing with that, though, is say you pick 15 days, right? And say you get admitted in the hospital, you have a full 15 days if you need it. Or if you use 2 days at that specific time you get admitted, fine, and you use 5 more 6 months from now or whatever else. It's just a whole bucket of days for the year. I will tell you the difference between like 5 days and 15 days is like $2. 5 days to 31 days, depending on the state, it's right around $4, maybe $3.50 to $4. So it's not like you're looking at an extra $10 or $15 per month in premium. It's actually quite nominal. Okay. I don't know if there's any questions on that. If so, please type in the chat or reach out or ask to be unmuted. But it is a bucket of days for the year. Observation room treatment. This is going to mirror whatever you selected for your daily hospital confinement. So if you picked $500 pay out there, observation room will pay out the same way. Observation room just means that you're just being observed. You're not officially admitted into the hospital. You get emergency room treatment at $200 4 times per year. Urgent care, $50 4 times per year. And then our ambulance is for air, ground, and water. And you can choose on that one between $100 and $400, and that pays out 4 times per year. Some people, depending on the state, really like that it actually includes water. For instance, my agents up in Michigan like it. My agents down in Florida love it. So some people really like it. Some people, could care less. So now, again, this is the first bucket. Here's our optional benefits. This is our second bucket of benefits. Okay, so these are optionals. I'm not going to go through each one of these. You guys can see it. Refer back to it. I will tell you that some of the most common ones that have been getting a lot of people, the ones that people tend to sell the most of are the skilled nursing facility, benefit. The outpatient surgery is a very popular one, obviously. Now in the middle there, you see minor, major, and invasive diagnostic. From what I've seen, as far as my competition goes, I haven't seen anybody else that covers diagnostic exams. We are the only ones that have diagnostic coverage. So it is very helpful if you're selling a lot of MA plans or if you're selling ACA plans. Again, it goes down to age 18. These are some key options that people do like to add on. So minor diagnostic, those are going to be things like x-rays. Okay. Major diagnostic, those are going to be your CT scans and your MRIs, things like that. Okay. And then invasive diagnostic, always say it's like invading your privacy because they're sticking things where you don't want them to go. Okay. To make sure everything's okay. So those are some nice options for folks if they're looking for diagnostic coverage, because I know a lot of MA plans have separate copays or separate co-insurances for diagnostic coverage or for those exams. So this can help cover those costs. The items on the right, they're a little non-traditional in the marketplace. So I don't know if those of you that are on here watching deal with folks in more urban areas or more rural areas. The top two, non-local transportation and family member lodging, those tend to lean towards folks that are in more rural areas. The way it works is if you live if you're receiving care more than 100 miles away from your home on the non-local transportation, we'll pay you 50 cents per mile up to 700 miles round trip, just to help you out with gas costs or whatever else. And then family member lodging, that's if you need to get a hotel room. If you're receiving care again more than 100 miles away from home, we'll give you $100 towards a hotel room up to 30 nights per year if you need to stay overnight or things like that. So those are very, very low cost to add on, pennies on the dollar, but they do help if you're dealing with people in those rural areas and they have to drive to an urban complex in order to receive care. Okay. Health screening, here you can pick $50, $75, or $100. It pays out one individual per year or 4 per family. Basically, there's a very large list of different things you can have done for health screening reasons. If you get those done, you send the claim form into us, we'll pay you your $50, $75, or $100. That list includes, it's not limited to, but it includes things like your annual physical exam, colonoscopy, stress test, mammograms, pap smears, prostate exams, immunizations, right? So say you want your flu shot. You can go to Walgreens, get one of those for free. That's great. Go to Walgreens, get a free flu shot. You get the bill that shows that was done. It doesn't matter if you paid for it or not, or if it is free. Just get the bill that shows that it was done, submit it to us. We will turn around and pay your 50, 75, or $100. So it's just to help promote, get your health screenings done to make sure you're catching any preventative things like that. So also with your MA plans, a lot of those are no cost anyway. So if you go get any of those done, they're not going to cost you anything on your MAPD. So, go ahead and get that done and make a little money doing so. So again, these are all optional benefits. Now, your third bucket of benefits, these are enhanced benefit options. And these are options. So again, remember this plan runs from age 18 to age 85. So we do have a maternity option for you if you decide to do so. And there is a 10-month waiting period. So you can't be pregnant when you take it out, and you have to at least have a baby after 10 months. But if you select maternity, or we also have substance abuse and mental nervous, if you select coverage for either one of these, it will turn around and pay out however you selected your hospital admission or your daily hospital confinement. Okay. So if you picked $1,000 hospital admission and, 5 days at $500 a day or whatever, and you go in for maternity or substance abuse and mental nervous, it'll pay out that, however long you're in there. Okay. I hope that makes sense. Now, here's where this product is approved and released. So the green, it's released and active, and you can sell in those areas. Okay. Maryland and Oregon, it's submitted there. It's not approved yet. And then Pennsylvania has our old hospital indemnity product. The new product is filed there. It's close, but it's not quite done yet. So just FYI. It is a simplified application, simplified underwriting. So there's 7 health questions that you have to ask. There is a height, weight, bill chart. There is a prescription drug check that we do on the back end, and a medical claims data check on the back end. So one thing that's different with ours compared to a lot of our competition. So a lot of our competition does a thing that's called a conditional approval. Okay, so you submit an application, they're going to be like, okay, you're conditionally approved. If you have a claim in the first 2 years, they might turn around and ask you for your medical records or whatever else. They could rescind your policy and just give you your premium back, or you might just get to keep your policy, right? With ours, we do not do a conditional approval. With ours, if you actually pass the underwriting and you get approved, you actually have the policy. So you don't have to worry about us coming back and requesting medical records or things like that. So that's just an FYI. It's a little bit different than some of the competition out there. So opportunities to sell these, right? So you can sell them at the same time as an MAPD. They are considered a health product, which is nice. We have some of the highest commissions in the marketplace. I believe we have the second highest commissions in the marketplace that's out there. And then no networks to worry about. We do pay the client directly, things like that. So it's just an opportunity to help solidify your client by adding another product in the home. Also, if you're selling MAPDs, it obviously is going to help cover those gaps within those coverages. And it might be even more prevalent this year than ever, just due to the shakeup in the MA market that's going on. So now, if there are no questions, which I haven't seen any, I'm going to go ahead and go into the cancer portion, our cancer product that we have available. So our Vantage Care cancer product, this one's actually, it can be issued between the ages of 18 and 99. And then you could select a benefit amount between $5,000 and $75,000. And that's actually in $1,000 increments. So all the competition out there usually does 5, 10, 15, 20, so on and so forth. With ours, you can actually do 7,000 if you want to, or 13,000 if you want to, or whatever you want. Just it gives you a little bit more flexibility. It is unisex rates. As far as tobacco goes, ours is tobacco distinct. Most everybody else out there is a unit tobacco rate. Ours is actually tobacco distinct. So we do ask a tobacco question. So if they do happen to use tobacco, it'd probably be better to sell them with another carrier. The reason why we do that is 85-90% of the people that we tend to that we see come through on our applications tend to be non-tobacco. So so what we've done is we turned around and increased our commissions and also got a little more competitive on our rate. So our rate is very competitive and our commissions are the highest in the market. So if they are a non-tobacco user, it could be a good option for your folks. So coverage is individual and spouse, individual and children to age 26, and family. And now I'm going to start getting into some of the specifics here. So not sure if you guys understand or know what carcinoma in situ is on the phone. So carcinoma in situ is cancer that is confined to a specific area and has not metastasized. What does that mean? It means it's cancer confined to a specific area, and metastasized means it means it's spread. So carcinoma in situ means it's cancer that has not spread anywhere else out in the body. It's confined to a specific spot. So a lump in the breast, it hasn't gone anywhere else. It's in that lump. Prostate cancer, it's just in your prostate, hasn't gone anywhere else. With our plan, you can actually select either 25% coverage or 100% coverage. Now, if you pick the 25% coverage, it's going to be less premium. And some people are like, well, why would I do that? Well, some people do that because it's going to save on your premium, but also carcinoma in situ tends to have the treatment tends to be less invasive. So if I have prostate cancer, it's just in the prostate, they're going to go and take out my prostate. I might not have to do much else besides that procedure, right? So some people might not want their full benefit amount if that's the case. I still always suggest to do the 100% option, just due to the fact that if I'm your client and a doctor tells me I have prostate cancer, I'm like, I have cancer. It's not carcinoma in situ. And I have a cancer plan. I'm going to want my full benefit amount, right? So I always suggest just selling the 100%. It's your discussion to have with your client, but that's just a little bit of a knowledge session there. So now here is all of our different riders and things like that. I'm going to go into these in more detail instead of right here. So I'm going to cover these in more detail here on these following slides. Okay. Now, here's our heart and stroke benefit. So if you want to think of this product as our cancer product is the anchor product. Okay. It's the main product on this. You can add the heart and stroke benefit to it. But it cannot exceed the lump sum cancer amount. So if you have a $10,000 lump sum cancer amount picked, you can do 10,000 of heart and stroke or less. Okay. It can't be 10,000 cancer, 25,000 heart and stroke. We won't allow you to do that. Now, The thing with this one, if any of those conditions on the left occur, aortic aneurysm, heart attack, heart disease requiring transplant, stroke, or sudden cardiac arrest, if any of those happen, you're going to get 100% of your benefit amount that you selected. If one of the situations on the right occur, okay, you can see the percentages. We'll give you a portion of your benefit amount right now to help you out. And then the rest of that money sits out of there in that bucket if you need to use it for something else. So say you have a $10,000 benefit, you need to get a stent put in. Hey, here's 10% of it. Here's $1,000. Your other $9,000 would sit out there in that bucket. Okay. Now, one thing I will tell you about this. Well, two things actually. If you happen to have the cancer and the heart and stroke, and say you end up utilizing the cancer benefit. So you get diagnosed with cancer, we pay that out, that benefit goes away. This then would become its own standalone policy. Okay. It doesn't go away. It becomes its own standalone policy. We carve off the cancer portion, and then you'd just be paying for the heart and stroke. Okay. Second thing about our product is that you see heart attack on here and you see sudden cardiac arrest. Okay. You're like, okay, aren't those the same thing? They're not. Okay. Heart attack is plumbing. Sudden cardiac arrest is electrical. Okay. Why is that important? Because everybody else that I've seen, I can't maybe say definitively because someone could have changed their benefits recently, but from everybody else that I've seen, sudden cardiac arrest is not covered under their heart and stroke benefits. Okay. Heart attack is, but sudden cardiac arrest is not the electrical portion. If you look on their exclusions and limitations on the back of their brochure, it specifically says sudden cardiac arrest is not covered by this policy. So it could be a very big thing. Sudden cardiac arrest, that's what they're called widowmakers. 90-80% of the time people die, things like that. So they're pretty scary, but we do cover it at a full benefit amount. Okay, so just FYI. Specified disease, again, we've seen more and more interest out of this and recently, it seems like. Again, it cannot exceed the lump sum cancer amount. So if you have 10,000 cancer, you can do 10,000 specified disease or less. The issue ages for the specified disease is only to age 74. So if they're 75 and above, they cannot select this as a rider. If they purchase it at 74, you can have it beyond the age of 74, but you just have to enroll in it before the age of 74. Okay. But it's become more and more popular, mainly due to like end-stage renal and some different things, some other conditions that people are a little, could be concerned about. So just some other options for you. Benefit builder. This is a benefit you pick between $100 and $2,000. And then every year that you haven't utilized your policy, it grows by that dollar amount. So say you have a $10,000 cancer plan, it doesn't get utilized this year, and you have the benefit builder, say $500. Next year it's going to be worth $10,500. If it goes another year, it'd be worth $11,000. So on, so forth. Okay. My personal opinion, just to be transparent with you, it's an expensive rider to add on. And I always tell folks not to sell it. I probably shouldn't say that as a sales guy, but that's just me being transparent. It's actually cheaper to add on more benefit up front than it is to put on this rider. Okay. So it's cheaper to add on a $15,000 or $20,000 benefit than it is just to add this rider. Okay. So just FYI. Cancer hospitalization rider. This rider you pick between $100 and $1,000 a day. If you get hospitalized due to cancer, we will pay you that dollar amount up to 30 days per year if you're in the hospitalized due to cancer, okay, complications of cancer. The cancer radiation and chemo rider, this is a schedule of benefits. You pick between 1 and 10 units, and then you multiply that by this dollar amount if you selected this rider. So say you pick 5 units, you take 5 and multiply it by, $100 for injected chemotherapy, and now be $500 per week. Okay. So on and so forth. So it's just a schedule of benefits for radiation and chemo. This has the wellness rider. So you remember on the hospital indemnity, it was called the health screening. On here, it's called the wellness rider. It's the exact same thing. It's at $50, $75, or $100 benefit. Here's a list of things you can have done. Like I said, you have the colonoscopy, you have your annual physical exam, pap smear, prostate exam, mammogram, immunizations, stress test, all those things. So again, it's just a way to get some coverage or get some benefit amount, even if you're getting these done for no cost. Okay. Second opinion and travel rider. We also spoke about this on the hospital indemnity. It was called that family member lodging and the mileage benefit or whatnot. On here, it's all combined into one. So you can see it has a transportation benefit and then the lodging benefit. Again, you have to be 100 miles away from your home to get care. But this also includes a second opinion benefit, which will give you $500 if you wanted to go get a second opinion from another certified oncologist about your cancer diagnosis or whatnot. If you want to go get that second opinion, you could get this done and we would, give you the $500 to do so. And this is a very cheap option to add on. If you add on this rider, it's like 36 cents a month. So very low cost. These are our two most popular riders. So the skin cancer rider. So those of you on the phone, if the cancer plan is for internal cancer, which melanoma is considered internal cancer, right? Along with all the others. Basal cell and squamous cell cancer is considered external cancer, not internal. Okay. The skin cancer rider is for basal cell and squamous cell carcinoma. Okay. So you can pick $250, $500, $750, or $1,000. If you say you pick the $500 benefit and you come down and you have basal cell or squamous cell, we'll pay out the $500 to you, and then you're good to go. Okay. And this re-triggers every 2 years. So say you had it done today, 2 years from now, you needed it done again, we'd pay for it again. 2 years from that, we would pay for it again. So every 2 years it reloads. Okay. So just FYI. And then the additional occurrence rider, this allows you to double dip on your policy. So if you have a $10,000 policy, let's say on cancer, right now, and that's all you have. You get diagnosed with cancer, here's your $10,000, policy's done. Okay. If you have the additional occurrence rider, say you get $10,000 policy, we pay out your $10,000, you're still paying your premiums. Once you're in remission, your bucket of money starts to fill back up. So 2 years in, you have 25% back in your bucket. 5 years in, you have 75% back in your bucket. 10 years in, your bucket's filled back up. Say you're 5 years in, you get diagnosed with the same cancer or different cancer, doesn't matter. We're going to pay out whatever in your bucket of money at that time, and then it's done. Also, if you have the heart and stroke added on to this as well, so you have the cancer and heart and stroke, and you pick the additional occurrence rider, it turns it on for both the cancer and the heart and stroke. So it's very low cost. A 65 to 69-year-old with a $10,000 policy, it's like $1.51 to add on. It's very low cost to add on. So, all right. In the blue is where this product's released. So you can see. And again, it's a simplified issue application. So the application, if you're just going for cancer, it's 3 questions. Do you have HIV or AIDS? In the last 5 years, have you been diagnosed with internal cancer? Okay. Or in the last 2 years, have you been advised by a doctor to get a diagnostic test to rule out cancer and you have not done so? So say someone has a lump in their breast, the doctor's like, hey, we need to do a biopsy to make sure that is not cancerous. And you're like, no, I'm not going to do that. We're not going to cover you. Okay. There is a height, weight, bill chart. There is a drug check on the back and a medical claims check on the back. And always remember the potential disqualifying medications for the cancer plan and the heart and stroke plan are different than the hospital indemnity because they cover different things. So you always want to check the underwriting on both. Okay. If you're selling them both together. If you add on the heart and stroke, it's going to ask a couple extra questions. If you add on specified disease, it's going to add a couple more questions. So for instance, if you add on the heart and stroke, it's going to add, had you have a heart attack and stroke in the last 5 years, so on and so forth. So it does add a couple more questions, but it's still a very, very low amount of application questions. Now, everybody on here, okay, does some type of needs analysis or warm up or whatever you want to call it. Everybody has a different name for it, right? So, when you're warming up and talking about these clients, some people are like, man, agents are like, I just really don't want to talk about it. It's uncomfortable. I don't like talking about cancer. It's depressing and sad and everything else. The thing is every person you talk to, including everybody on this phone, has seen cancer affect somebody in some way, shape, or form in their life, whether them personally, a family member, a friend, it doesn't matter. You've seen it affect somebody emotionally, physically, and financially in some way, shape, or form. Okay. It's a very prevalent issue. It is something that needs to be, talked about. I mean, 1 out of every 2 men, 1 out of every 3 women will get cancer, period. The American Medical Association came out a couple of years ago and said 54% of all cost of cancer is considered non-medical. So think about that. More than 50% of the cost of cancer is not your deductibles and your co-insurances and all that. It's non-medical costs that people don't think about. We're going to talk about that more in a minute. Okay. But it is something that you need to find with your client or talk about with your client. Now, how do you do that? Right? Well, MAPDs all have a 20% cost share in chemotherapy. Doesn't matter what MAPD you sell, they all have a 20% cost share in chemotherapy. Okay. So if you're talking about that with Mary, your client, you go, hey, Mary, you got a 20% cost share here on your chemotherapy. I just want you to keep that in mind. But remind me at the end of this presentation that I have a plan that can help cover that. Okay. Can you remind me of that? Mary hopefully goes, yeah, sure. No problem. When you get to the end of your presentation, you sell your MAPD product and you're done. So you're buttoning up that sell and you go, hopefully Mary goes, hey, you mentioned you had a product that could help cover that 20% on chemotherapy. That's a positive thing. She remembered, she brought it up. That's a buying question, right? If she does not, you say, oh, Mary, by the way, remember I told you about there's something to help cover that 20% of that chemotherapy. Yeah, let me talk about that for a minute. It's a 5 or 10 minute conversation. It's not a 30-minute discussion, okay? Everybody you talk to has had some relationship, good or bad, with cancer. So talk about it. You can also just ask the question, hey, Mary, by the way, who's your cancer insurance with? That's all you have to say. Who's your cancer insurance with? Oh, I don't have cancer insurance. I bet you 95% of people you talk to do not have cancer insurance. So that opens the door. You're going to go, oh, Mary, okay, you don't have cancer insurance. Well, has anybody ever seen any family members or friends ever, have an issue with cancer? Oh, yeah, my best friend did. Okay. Was that kind of a financial burden on her? And they, oh, yeah. It gives you a window to open it up. So just ask a question. If you ask a question, you're going to get a sell. We see about a 27% add-on rate. So a little better than 1 out of 4. Okay. The other thing is that you can sell them at the same time as an MAPD, which is nice because they're considered health products. Also, say you didn't get to it during AEP because it's going to be a crazy year this year, right? You can sell these throughout the year. So say you have 100 clients in your book of benefit in your book, call them during the rest of the year. You at least can get 25 sales out of your 100 people. You should at least get 25 sales out of your 100 people. And the commission is extremely well worth it. Okay. It's going to take care of your client. First of all, they're going to have a good product at a low cost, and it's going to help you live off your money you make it. So it's a good thing to ask about. Now, remember that 54% of all costs are considered non-medical. Here's where we can get into that. Okay. I've done this for 24 years. There are gaps in MedSup. I've had agents throughout all my years go, oh, well, I sold MedSup. MedSups cover everything. Well, MedSups cover a lot of things, but not everything, right? They don't cover your prescription costs, right? Prescriptions are going to be even more expensive probably this next year than ever. Monthly bills, child and animal care, right? So say people are still working. A lot of people are working longer in life, so on and so forth. They get hospitalized due to cancer. They might still have long and short-term disability, which would be good because that covers 60 to 70% of their income. But most people are still paycheck to paycheck. How are they going to cover that loss of 30 or 40%? Also, if they don't have long or short-term disability, then they're even more so to sell this product. Animal care. A lot of seniors, a lot of old people, even if they're single, have a pet of some kind, right? Well, if they get hospitalized, who's going to take care of that pet? If anybody on here has pets and have had to board a pet before, it costs $35 to $50 a day to board that pet. Okay. Well, just imagine that. Say they have a small dog and they have to board it for a month. Well, a month's 30 days at $50 a day, that's $1,500 in a month. It's very expensive. These are costs people don't think about. Travel expenses. A lot of people they have a certain type of cancer. They want to go see the best doctor for that type of cancer, right? Well, not everybody has the luxury of that doctor living in the same town they live in. So therefore, they're going to have to drive or fly or stay overnight in a hotel and eat out and do. MedSups don't cover those expenses. They don't cover gas or food or hotel, right? So these lump sum plans can help cover those costs. Here's a lump sum. Use it how you will. Use it to pay your copays, your deductibles, your coinsurances. Go buy a new truck, go on a trip, help pay for other expenses, however you see fit. Okay. Clothes and wigs. Wigs are a big deal for women. Close. I put this on there not too long ago. I had a portly agent guy I was talking to, and he's like, "You need to put clothes on here." And I'm like, "Well, why do I need to do that?" And he goes, "Well, you can't tell now, but 15 years ago, I had cancer." And he's like, "And I lost 15." He's like, "I lost 100 pounds 15 years ago." I'm like, "Okay." He's like, "Well," he's like, "when you lose 100 pounds," he's like, "I had to replace my entire wardrobe." So think about all the clothes in your closet and everything that's in there right now. If you lost a whole bunch of weight and you had to replace all those clothes, what does that cost amount to? It's more significant than you think, probably a couple grand. A lot of people don't just have a couple grand laying around to go buy new clothes. So those are things to think about. Okay. Also, experimental therapy. If doctors are going to come in and go, "Hey, Mary, we have this new experimental treatment. It helps people with your type of cancer. 95% of the people that have your type of cancer. Do you want to do that?" You're like, "Absolutely." Doctor's not going to talk to you about your insurance. Doctor's going to talk to you about what they can do procedurally to help you. That's their job, right? To help you, to heal you. They're not there to talk about your insurance. The thing is if it's considered experimental therapy, it's not covered by Medicare. If it's not covered by Medicare, it's not covered by your Medicare supplement. So things to look out for. And again, MAPDs, there's like 20% cost sharing chemotherapy. Your max out of pocket exposure, depending on your area, your max out of pockets could be anywhere from $3,000 to $7,000. Say your max out of pocket's $5,000. Well, if you get diagnosed in August or September, you're going to hit your max out of pocket before the end of the year. What happens January 1st? It starts over. So imagine meeting your max out of pocket twice within 8-9 months of each other. A lot of people don't have 5-10 grand just sitting in their bank account to help cover those max out of pocket exposure costs. Okay. These can help with that. Okay. And again, they can be sold at the same time as a MAPD because they are considered health products. Okay. So agent opportunities. Always ask the question, what do they do at McDonald's who go, "Hey, can I get a cheeseburger? Do you want fries with that?" They just said, "Do you want fries with that?" "Hey, Mary, oh, who's your cancer insurance with?" It's real easy. Just ask a question and you're going to double your income. I promise you, I've seen it for years and years and years. Okay. I'm not just trying to be a sales guy or anything else. I've seen it. And it's important. I mean, it's very important. I'll give you a little bit of a testimonial here. My sister passed away in 2006 from leukemia at the age of 31 years old. Okay. She had just quit her corporate job 2 months prior to start going into real estate. She had not gotten her, she hadn't purchased an individual health plan or anything at that time yet. And she got diagnosed on January 2nd of 2006 with AML leukemia. Okay. Acute myeloid leukemia. She was in the hospital for 9 months. She passed away on the 23rd of August. Now, she had quit her corporate job. She had no health insurance. She had to go on Medicaid because she had no money coming in. And her bills were at that time, I mean, you're talking almost 18 years ago, were like $1.2 million. She had to be on Medicaid because of it. We had to do fundraisers every month, multiple times a month, and trivia nights and all these different things to help pay for her house and her car and just her bills in general, so she didn't lose everything. These are important things. You're not going to think you're going to get leukemia at 31 years old, right? So you always ask the question and always at least discuss it with your client. If they say no, fine, they say no. I even know some agents that have their clients sign a attestation. They have it printed up that says, "I just need you to sign this to state that I did talk to you about cancer insurance and you decline the coverage." It makes them second think about it because they actually have to sign it and go, "Okay, I attest that I do not want cancer insurance," so that you can't come back later if you get cancer and say, "I never talked to you about it," and you try to sue me. It makes people second guess themselves and really think about it because it is, like I said, 1 out of 2 men, 1 out of 3 women. Okay. The other thing is for your clients, the same thing with the hospital indemnity. This helps cover all the gaps within the hospital indemnity or within the Medicare Advantage plans. They all have copays and co-insurances and things like that. You need to have those covered. For $40 a month or $50 a month, if you're paying a zero premium, it's not going to break the bank, but it's going to keep you in a nice, stable financial situation. The one thing I will say, though, is don't overcomplicate it and keep it simple. Give them 3 or 4 options of bucketed plans that you've created based on your area. So if you're selling ACA or Medicare Advantage plans, base those 3 or 4 options based off the most common MAs or ACA plans you're selling. And each one have a bronze, silver, gold, and platinum plan or whatever else. But don't sit there and go, hey, Mary, do you want this rider and this rider and this rider and this rider and this rider? It's going to scare them to death. They don't speak our insurance language. They don't know all the ins and outs of it. It's going to confuse them. It's going to scare them. And they're just going to say, never mind, I don't want it. I don't understand it. I don't want it. So just keep it simple. Be like, hey, Mary, here's this plan. It covers this, 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 and this. I think it's good for the plan that you're selecting to purchase, say, on the MAPD side or your ACA side. So which one would you like? Would you like this one, or this one? And they're usually going to pick the middle one, right? But just keep it simple. Don't offer them 15 different options and do. Okay. Again, the premium is affordable. The underwriting's easy. They're not long conversations. They're not a half-hour conversation. They're 5-10 minute conversations, and commission is worth it. When you have more than one product in a household, your chances of persistency go up dramatically. So now let me show you our e-app. So here's our e-app. So it's agent.bflick.com. You're going to log in here at the top. You go to new application. I'm just going to do Texas. Let's do a 65-year-old. Okay, so you put in that information. You go to products and rates. Now, when you're in here, it's going to show you all the products for the zip code you selected. Okay, so here's our cancer product. You go in here, has all the different riders, things like that. So say you're in here and you're like, oh, I need to look at the underwriting guidelines. You can just see these radio buttons up here. Oh, they're not radio buttons, but to see these links. You can click on the underwriting guidelines. It opens up a separate window. And in here, you can see like the base benefit options you need to select. You see the optional riders and how they're broken down. You can see the disqualifying meds for cancer, for heart and stroke, for specified disease. Down here is your height, weight, build chart, things like that. Okay. So easy to access. Don't just throw it against the wall and be like, oh, hopefully they get approved, even though they're 5 foot and 400 pounds, right? Don't do that. Just always check these out and make sure, you're not just wasting your time and the client's time. Okay. So I'm just going to quote one real quick so you can see it. So say you want to go in here and say you want $10,000. Say you want heart and stroke at $10,000. Carcinoma side 2 defaults to that 100%. Here's a tobacco question. Yes, you want additional occurrence. That's going to be additional occurrence for both cancer and for heart and stroke if you do that. Okay. I'm going to show you second opinion travel rider and skin cancer. Let's do $500. Let's just do something small here. Requote. Now the difference with ours too, that's $57. That's for $10,000 cancer, $10,000 heart and stroke, $500 skin cancer benefit, second opinion and travel benefit, and then additional occurrence. Okay. Pretty easy. Now we do show the breakout for every single rider. So hey, I really need this around $50. You know that you can cut out some of these and get that cost a little cheaper, but where you can cut costs because we give you the prices of the actual riders. Okay. Now, if you just want to do, 10,000 cancer and not heart and stroke, $27.10. So real easy. If you like what you see, just hit add to cart. It puts it over here. Okay. And I can minimize that. So you're going to go in here to Vantage Flex Plus. Again, here's the underwriting guidelines. You can click on that. Opens up a separate window, shows you all the different optional riders in here and how they're broken down. Again, this is going to have different underwriting guidelines because it covers different things besides just cancer, heart and stroke, or specified disease, right? So it covers all kinds of other conditions. So the disqualifying medications could be a little bit different. And then your height weight chart could also be a little bit different. Okay. So just be aware of that. Let's say you want to go in here and say you want your hospital admission, say $1,000. Daily hospital confinement, let's do $350. Now, remember I told you your days, it's a bucket of days for the year. It's not specific to a certain benefit period. So this is for the year. I'm going to show you what this looks like price-wise. Okay, so right now, I'm going to requote this real quick. Oh, so maternity is only available for people between the ages of 18 and 45. Once you're age 46 or older, it's automatically excluded. We do that because we don't want a bunch of 65-year-olds getting accidentally added on maternity, just FYI. So mental nervous, I'm going to hit exclude. And then I'm just going to quote this real quick. Just want to show you the price difference. Okay. So for $1,000 admission, $350 a day for 5 days, right? And it's got all these other benefits that are automatically included. It's $39.88. Okay. Now, say I go from 5 days and I want to go to 15 days for the year. Okay. I requote it. It was $39.88, $42.80. So it's not a big difference. Okay. I want to go to 31 days. So it's $42.80 for 15, 43, it went up $1. Okay. So it went up $1 to go from 15 days to 31 days. So not a big difference. Less than $4 from $39.88 to $43.72 to go from 5 days to 31 days. So it's just good to add that in. Okay. That's my opinion. Now, if you want to go in and say you want to do major diagnostic at 300, say you want to do outpatient surgery at 500, minor diagnostic at 100, whatever, requote. So you add those all in, it's $58.56. That's a pretty loaded up plan. That's everything on there. You can see the cost of each of the riders. So say they are like, I need to be around $55. You know that you can cut out certain things or tweak certain dollar amounts or whatever else to get there. Okay. Once you like what you see, you can hit add to cart. It puts it over here. So you're done. You want to go save it next. It then is going to show you, you can then jump around to all these other areas. So say you want to go to payment and billing. You have 2 products on here. Okay. We only do one draft. Doesn't matter if you had 5 products on here or whatever else. We only do one draft payment. Now, say they drop one of these products off, they cancel it, whatever else. Then it just carves out that specific dollar amount from the draft amount. So just FYI, a lot of people really like that. We only do one draft. Some companies do multiple. We just do one. You can pick bank draft or you can do credit card. We can do credit card on initial and reoccurring. There is a 3% surcharge if you do credit card, just FYI. Okay. Also,
Ryan,
yes.
can I ask a quick question?
Yes.
Is there any either household discount or multi-policy discount?
Not for either one of these products.
Gotcha. Okay.
Some of our other product, like our short-term care does. Short-term care has a 10% household discount, and then our MedSup has a 7% household discount for roommate rule. So,
okay.
On the premium payment, you can do it based on approval. You can do it based on effective date or other. You can pick between the 1st and the 28th of the month. So it's July 17th today. So say you select, I want an effective date of August 1st. You can do that. Okay. Which could be the effective date, or, I'm sorry. But you're like, even though that's the effective date, I can't really pay until the 10th. Okay. Because that's when I get paid from work or whatever it is. Okay. You can do that. Your policy will still go into effect, and then we will draft the money on the 10th of August. Okay. Just know that if for some reason there's insufficient funds or anything else, it's going to be in a pickle because they'll be in lapse already. Okay. Because we haven't collected an actual premium. Now, also, we will not pay commissions until we get the initial premium payment. So even if it gets approved, we're not going to pay you commissions until we get the initial draft. So FYI on that. So say you go in AEP and you write a whole bunch of these, and the draft or the premium payment, the draft date's not until January 1st or whatever else. You're not going to get your commission check until we get that initial draft payment. Now you could do upon approval, and then the second payment would be, after it's gone into effect. You could do that just so that you would get paid, and it helps feed you during AEP. So just FYI. Another thing that's cool is that we actually call it draft schedule. It's basically Social Security billing. Compliance didn't really want us to name it Social Security billing, so we call it draft schedule. But basically we draft the same day as their Social Security check hits their bank account. So it's either the first and third of the month, the second, third, or fourth Wednesday of the month. If that happens to be a holiday or a weekend, we will draft it the day before, just like their Social Security check's going to hit. This helps with no lapse issues. It takes some money out of their account in a timely manner. We just see a lot of people starting to use the draft schedule just due to it helps with keeping policies on the books, so on and so forth. Okay. Go back here. We do take MasterCard, Discover, American Express, and Visa. There is a policy fee only on MedSup and short-term care, but none of our other products, including our final expense, have a policy fee. So just FYI on that. Our e-app signature options, we do DocuSign. So you can do either face-to-face, you're sitting right there with the client. You can do it via email where you send it to their email, or you can do it via text where you type in their cell phone number and it sends them a text message and you can just sign with your finger on that. Well, you click on the link and you just sign it with your finger. Makes it real easy. We are working on a phone signature option. I don't think it's going to be done before AEP, but that is something that is in the pipeline, just FYI. Incentives, everybody likes incentives. We do have a sales incentive going. It started September 1st of 2023 and goes to September 30th of 2024. The trip is March 9th through 16th in 2025. It's at the Four Seasons Hotel in Buenos Aires, which will be very, very nice. If you've been contracted with us in the prior to March, you have to have 150,000 credits. If you're contracted with us after March 1st, which is now obviously, it's only 75,000 credits. But we just changed these credit amounts a week ago. So hospital indemnity, cancer, and short-term care, you get 400% credit. So if you write a $500 hospital indemnity plan annual premium, you would get 2,000 credits towards these amounts. Okay. Final expense in life, you get 250%. And then open enrollment and underwritten med subs, you get it's 2-to-1, 200%. So it's still not that hard to get there, especially med subs when they average around $1,800 a month. You write one, that's 3,600 credits towards one of these numbers. You could get there fairly quickly. You still have 2.5 months to get there. I know it's a little bit of a stretch, but you could still possibly do it. One nice thing with our trips as well, we do not 1099 you for your trips or convention. You will have to listen to me speak for about 20 minutes, but we won't 1099 you, the 5 figures for the trip. So that's always a nice thing because it doesn't hurt you on your taxes. Okay. Also, we have a app to reward. This is for our ancillary product line. So hospital indemnity, short-term care, cancer, and life product. It has to be at least a $300 minimum annual premium or $25 a month premium. And you can get $50 per app once you write 5. So once you write 5, you get a $250 bonus because it retros to the first one. And then every app after that's $50. So it's a nice little bonus on top of your normal commission. So it's very, very nice. And then here's important phone numbers. And Courtney, I can send this to y'all. That way, if you need to distribute or whatever else, remember it's for agent use only. You can't send it to a client or anything like that, but it is a little easier to, in my opinion, to look at some of these grids and benefits and things like that in this format than it is obviously a sales brochure or anything like that. It's just a little easier.
That would be very helpful.
Yeah, if they want it as a reference pointer or whatnot. So. And then there's my mug there. And then this is Brittany. She's my sales coordinator. I don't know if any of you on the phone have worked with Corey Jones in the past. He got promoted to the AVP at agency, so he does contracting and commissions now. Brittany's my new sales coordinator. But here's my cell phone and my email. Feel free if you have questions or comments or just concerns or anything like that. Feel free. I travel 4 days a week, 45 weeks plus a year. So feel free to reach out to me anytime you may need to, but that's my cell phone. So it's easier to just text me or whatever else. But I appreciate, NCC allowing me to speak to you all today. And I appreciate your all's time actually taking out your busy schedules, especially this time of year to listen to what we have to offer. But I definitely appreciate it.
Hey Ryan, we did just get a question in from David. It says in Georgia, 42% select MAPD and 25% select med subs. What are the percentages on your products?
Percentage as far as I'm not sure I understand the question.
Yeah, David, do you mind coming off of mute and actually verbalizing that question?
You hear me now?
Yes.
I'm just trying to target if you've got ACA clients, are they
Ooh, you're really
likely to look
sorry.
at cancer, or are they more likely to look at hospitalization? Same thing on the Medicare side of things. So they're more likely to look at cancer hospitalization, or is it just hit or miss?
Still kind of hard to hear you. You're kind of cutting out a little bit. Did Courtney, were you able to pick up on what he was asking?
Unfortunately, I wasn't. I'm sorry, David. Could you try one more time?
Sure. Let me see if I can get my mic all situated. Is it better?
A little better.
A little better. All right. Well, I'll try to be louder then. So just trying to understand the consumers that purchase these products. Is it across the board ACA and Medicare recipients, or do Medicare recipients look at one of those products more often than another product?
So we're seeing a lot of med sup folks purchase cancer products. They don't really necessarily need the hospital indemnity. Obviously, I mean, it would be more of a money grab if that was the case, if they're on a normal, like on a G or things like that. But Medicare Advantage and ACA people. So our product is significantly taken off here in the last several months due to more and more people getting in the ACA market. So we've seen a very large increase in the hospital indemnity. But then obviously that's seems to be more of a tailored type product for ACA or MAPD products because it fits more of the benefits that are within those plans that have gaps, if that makes sense. But cancer is an important one, and we still get a lot of cancer sales. Actually, cancer is still our number one selling product. The hospital indemnity is a newer product than the cancer product, so it's ramping up. But the cancer product, it's really, as long as the agents are asking the question and presenting it, will you get the sales? And there's still a lot of agents that reluctantly do so, if that makes sense. Does that help answer your question?
Yes.
Okay.
Any other questions or comments for Ryan?
I like to add a couple of things. So
Sure.
what I like about these products is that there's quite a bit of versatility in there. And, as an agent, if you get creative with it, you can find a lot of different ways to make it benefit your client. Ryan mentioned that at 64.5 to 65.5, it's guaranteed issue. And I know I came across quite a bit of few Medicare people who are aging into Medicare who couldn't quite afford a full-blown Medicare supplement, but they really liked the option of not really having a lot of out-of-pocket expense, but they couldn't afford the Plan G or Plan F premium or whatever it may be. But there's a lot of zero premium MAs, and you can go in there and customize this coverage. If your MA's got 7 days at $100 a day, you can pick that benefit amount to cover that. And on the lump sum, the quickest way for a client to meet their out-of-pocket max on their MA is that 20% on that cancer. So, pointing that out to them and then going along with that cancer product works really well. And if you're doing the under 65 market, beyond ACA, really the ACA is about the only thing that will cover maternity. So having that maternity option on that indemnity coverage, if you're writing a short-term care coverage for somebody, if you're doing some other indemnity products that don't have any maternity whatsoever, those are excellent products to add on there to them.
Good points.
I absolutely agree. I also think that cross-selling leads to much more sticky business. The more products that you have in a house, the least likely that client is to pick up the phone and call an 800 number. So it's really just helping you protect your business as well.
And something else that's really nice about indemnities is when you cover the client, and once they get back from the hospital and whatever they had to have done, instead of them getting a bill, they get a check. that goes a long way to keeping the business in the house too.
Well, guys, we do want to be respectful of your time. If you have additional questions, please feel free to reach out to Ryan, myself, any member of staff at National Contracting Center. We're all here to help you out. We really appreciate Adam and the producers group's partnership with Bankers Fidelity, and we look forward to helping you guys increase your personal business and everybody's business across the board. Thank you so much.
Hey guys, if you found this video helpful, I'd like to ask you to do a couple things. We'd like to ask you to subscribe to our channel, like this video, and ding that notification bell. That just keeps you notified anytime that we upload new content. If you'd like to stay in contact with us in between videos, feel free to check us out on our website, nccagent.com, or follow us on our socials. You'll be able to find the links to our socials in the description below. If you'd like to join us for a live session of Wisdom Wednesday, feel free to check out our events calendar on our website, nccagent.com, and register for our next session. We hold them every third Wednesday of the month from 4 to 5 p.m. Eastern. We hope to see you on our next session.